How do you win managing your loved one in terms of their chronic wound? What happened to cause the wound and what made the wound heal? Today I'm going to talk about some successful stories in cases where we were able to heal the wound. Let me introduce myself. I'm Alan Bienstock and I'm a board certified plastic and reconstructive surgeon. I don't do any more cosmetic surgery in the hospital. I only do house visits and take care of your loved one to heal their complex and chronic wound in the house. I had a patient I saw 3 to 4 years ago in Brooklyn who had an infected large sacral pressure ulcer. What a sacral pressure ulcer means is on the behind. It was about the size of a football, and it was due to the fact that the caregivers were not turning the patient and it became infected. I had to perform multiple debridement, which means I cut out all the dead tissue, put the patient on antibiotic. The key factor was the brother, who was the healthcare proxy, and the loved one who was involved. And what did he do? I had a long conversation about the severity of the problem, and I told him, I'm all in if you're all in. The first thing he said to me is, I pray to God that we're going to help and heal my sister, and we made a whole plan that we were going to work together and change the whole situation around. He got rid of the caregiver team because they weren't turning the mom, they weren't checking in with him. He replaced it with all brand new caregivers who he screened, and obviously it took time for him to find new caregivers that were really going to take care of his sister. But he did this over a 4 to 6 month process. We had a whole nursing team that came in and that was not performing the wound care that I recommended. We switched them out as well. This was due to the impetus of myself as well as the brother. After we got a private nurse involved with brand new caregivers and improved the patient nutrition, the wound healed within about 6 to 8 months. We started with an infected wound that almost killed the patient from being septic to a successful story. We were able to heal the wound because the brother was involved and was able to change the whole care plan, the whole care team. And we were able to work together in collaboration with the primary care physician and the nurses. And this was a great story, and I was really proud of that we were able to heal when no one thought we were going to be able to do this. Stay tuned for our next episode. We'll go over another victory in terms of healing a chronic wound.